can write the demographics down on your own because you'll know who you're examining, right? And then the general survey part. Who can tell me how you figure this out?
I think by looking at the patient.
When they're coming in.
Yeah. All throughout the exam.
Yeah.
So you're not going to go through and say, do you appear your stated age? What is your level of consciousness? You know, no, because you're going to get that throughout the exam, and then at the end you go back and go, oh yeah, you know, they're alert and oriented, and they have good nutrition because their arms and legs were, you know, good muscles and stuff. So
yeah, if they responded to my questions, like, then obviously they don't need an interpreter if they understood them.
Yeah. What would be vision accommodation? What is something I'm going to look?
Do they have glasses
they
or
glasses
hearing aids?
or not? Okay.
Glasses, hearing aids, dentures.
Okay.
What about the height and the weight?
No, those are there because we want you to know that's part of the exam, but we don't have time to do that. We don't have time to do temps either.
Just radial pulse and pain.
Yeah.
Radial pulse.
Yeah, that's all we'll do.
So no other vitals besides that?
Yeah.
Yeah.
Well, until you get to cardiac, and then there's an apical pulse, but yeah.
So what would be radial pulse? Respiration? Respiration?
No.
No. So pulsate pain.
Yeah, I mean, it can take a while to get a full set of vitals, and we don't have time to do that. So, okay, we assess that elsewhere. All right, so I'm not going to do the general survey. I'm not going to do her height and weight, and
at the end you could go through and then
we'll talk about it. Yeah.
Okay.
So the first thing I'm going to do, and the other thing I want you to notice is how often I look at this piece of paper, because I haven't looked at this piece of paper for a year now. So. Notice that. So her skin, I'm going to look at her skin, and what we notice about her arms is that she has freckles. She has freckles, and the color, color's hard because if you're Caucasian, people tend to say white or pink, but if you have darker skin, there's no, so sometimes color is appropriate for ethnicity. Or how do you say that?
Yeah, color is appropriate.
Pigment appropriate to ethnicity.
You also want to say what color it is.
Yeah.
Pigment of blank is appropriate.
Skin is uniform pink, appropriate to ethnicity.
Yeah, uniform pigment, uniform color, whatever, except she has her freckles. And so the temperature, I'm going to use the back of my hands, and I'm going to feel both arms at the same time because I'm comparing right to left. And her temperature, her arms are warm bilaterally, and the temperature is equal. And then I'm going to feel the texture of her skin. And this texture of her arm skin is pretty smooth. Elbows are a little rough, but everybody's got rough elbows. So I'm going to say that her skin is smooth. I don't see a lot of dry, flaky skin here. So I'm going to assume that her skin is not dry. And I'm going to look at her turgor. She is not an older adult, and so technically I can do skin turgor on the back of her hand, and her skin returns very quickly. If she were an older adult, yes, I am now,
I are.
Still pretty good.
You would do it up here, okay? But none of you are older adults, so you're good. So she has good skin turgor, and at least in this part of her body, I don't see any lesions. I'm not going to talk about all of her freckles. Okay. So, but if she had, a big scar or an open spot or something like that,
senile lentiginous.
Yeah. You're not senile. Okay. So, scalp, hair, and cranium. So, if you choose not to remove your hijab, that is absolutely fine with me. If you choose to remove it, that's fine with me as well. I don't care either way. Just wanted to say that.
And you can charge that as the patient declined to remove her hijab. She is wearing a hijab that covers her hair.
Yeah, and
that's how you would chart that.
Yeah, I'm totally fine with that. Anyway, so you're going to look at head and face now. So we're going to look at her scalp. And if I were taller, I would look. And sometimes, and I would have gloves on too, but I'm not messing with it. And I don't see any flaking, I don't see any psoriasis. Definitely no infestations, nothing like that. Okay.
Good.
Yeah, and then I'm just gonna feel her lumps, her bumps, and her cranium and her scalp is very smooth, and it looks like it's a normal size. So what is the word we use for
Normal
size? About it. Right, that's exactly what I would say. Then I'm gonna look at her facial nerve, which is cranial nerve 7, as we all know.
Yeah.
And so you're going to ask, and it's a motor nerve, right?
Yeah.
So we're going to ask her to eyebrows up, frown. Can you smile? Can you squint your eyes? And can you puff out your cheeks? And then let the air out of them. Okay. So she's able to smile, frown, squint, puff her cheeks.
Cranial nerve 7 is intact.
That's right.
Bilateral.
Yeah. And if you notice the wind, the air came out of her cheeks, same on both sides. Okay. All right. So her temporal artery. You should notice I'm doing them both at the same time. I feel both of them. It's not really strong, so I would say 1+, but they're equal. Okay, so you guys just both at the same time. Okay.
Like I said, feel free to move in if you need to.
And then I would move down from there to her temporomandibular joint, and then I'll find it. Okay, and then I'll ask her to open and close and open and close, and she's definitely got clicking. So is there any pain with that?
Sometimes.
Sometimes. So is there pain now?
No.
No.
Only if I chew gum or like something really difficult to chew.
Yeah. So her TMJ is mobile and clicking is palpable.
Occasional?
Yeah.
Occasional cooking?
Oh yes.
It's always,
Yeah.
it always, if you open my jaw that far, it always does it.
Yeah.
I think I made you all feel my jaw.
Yeah.
Okay, then we've got her frontal sinuses, and tell me if it hurts. Okay, so I'm pushing our maxillaries in pain.
A little
bit.
A little sensitivity
A little
here.
tender. Okay, so her right maxillary sinus is a little sensitive to palpation.
I've had sinus surgery in the last 2 years.
She has, and so
And I have a history of sinus infections.
yeah. So if you wanted to, do a pain assessment, you could, but let's don't draw this out. So we're just going to say it's tender. Okay. So then we're looking at our external eye structures, and of course those are brows and lashes and lids and that kind of stuff. I'm looking to see that they're uniform, that they're symmetric. She doesn't have any ptosis, which is you would call as drooping.
Yeah.
Okay. Doesn't have any of that at all. And so then I'm going to look at her conjunctiva, and so I'm going to ask if I can I pull the bottom of your eyelid down? Okay. So I'm going to look, and you probably can't see it from there, but it's moist and it's pink. And if you were really mean, I will not make you do this, but if you were really mean, you can lift the top of their lids and it should look the same. Okay. Her lateral glands are right here. I'm just going to put my thumbs right here and feel your glands. Does that hurt? Okay. And then I'm going to look, and I'm going to see that there's no drainage and there's no pain. Okay. Her sclera, I don't know if you all can see it, but her sclera are white. There's a little bit of vessels there, and sometimes they call that injected. I don't know why they call it that, but whatever. But anyway, her sclera are normal.
I also sometimes have dry eyes because I take Adderall, and sometimes my mucous membranes are a little bit dry for that reason.
Yeah. So then I'm going to look at her cornea. So I'm going to look straight, and it looks rounded to me. And it looks rounded to me, and I'm going to look at her iris, and her iris, can you just look straight ahead? Her irises are round, and sometimes people will have surgery for glaucoma, so sometimes people have like a pie-shaped thing taken out of their iris, so that would be something to note, but she doesn't. And so at that point, then I will look at her pupils.
And they're blue.
And they are.
You can write the color too.
Okay, so I would like for you just to look straight ahead, and I'm going to shine this light in your eyes twice on each side, okay? All right, so I'm going to go once for direct. Okay, if I can make it work. Once for direct. It reacted. Once for consensual. The other one reacted. And I'm going to do the same thing over here. Once for direct, reacted. Briskly, I might add. Once for sensual. That one reacted. Okay? All right, so can you look at the tip of my light and then look back at the wall? And look at the tip of my light and look back at the wall. And did you notice what happens? When she looks at the tip of the light, her pupils constrict. When she looks at the wall, they dilate. That's accommodation. So how are we going to write that?
Paralaterally. Present.
Yeah, pupils, P, equal. They're equal. Round, they're round. React to light, RL, and A, accommodation. Okay?
Or Furla, as I heard sometimes.
Yes.
Bilaterally was also correct.
Yes. And they react.
I want to say how big they are.
And they react briskly. And then you can take your handy-dandy little key here on your light and decide how big they are. And they are pretty darn big right now. They're about 6, I think. Dang. So, there you go.
What was that?
Or a 6.
When you do Perla, do you need to write bilaterally since equal kind of implies that they're equal?
You know, I never do, but I guess.
Yes.
Okay.
Yeah.
The equal. Yeah.
I know.
Yeah.
Equal
Just
round.
you don't know how to spell bilaterally before now. You're in trouble. Oh, I forgot. I need this. So the corneal light reflex is to tell whether or not her eyes are focusing in the same direction. And so if you just want to look there, or at that light, well, you could look at that light, look whatever, but you can see the light reflected in the same spot in her eyes. And if she had one eye that was deviated, like with amblyopia, she'd have one spotlight maybe in her pupil and the other spotlight over on the iris or something, okay? So you can also do it with a pen light, but I just hate putting a light in somebody's eyes when you don't have to. Okay, and then we are going to do cranial nerves for 3, 4, and 6, which is extraocular movements. And so what I'm going to do is I'm going to put my hand on top of her head so she doesn't cheat, because I know cat cheats. And I'm going to take her through the 6 cardinal positions of gaze. And so I'm going to ask you to look at the top of my light and just follow it with your eyes wherever I move it, okay? So I'm going to go up and down, and then I'm going to go side to side, and then I'm going to do the diagonals, and then that diagonal. So, did you notice that her eyes tracked evenly through the 6 cardinal fields of vision?
There was a little discomfort down there at the far end of that range.
I probably took it a little too low, but anyway, yeah, so.
What do
Her
you
eyes
say when
track
you
together?
What do you say when you document that? What do you say when you document that? The method.
I would say that her eyes track through the 6 cardinal fields of gaze. I don't know. I'm losing mine.
Usually say
Yeah.
cranial nerves, whatever.
Yeah.
Cranial nerves are intact.
3, 4, and 6 intact.
Bilaterally
Thank you. And you could also say,
intact.
and you could also say eyes track together, because that's what you're looking for, is do the eyes track together.
Do it one more time.
Sure. Okay. Yeah. So you don't have to follow it if you don't want. So anyway, I would just hold her head, because people will do this, right? And that's not what you want them to do. So you just want to look at the end here, and you don't want it too close, because then you'll make them go, ooh. You know, you don't want it too far. So just about, oh, I don't know, a foot or so out, and then you just have them follow it, and you're going vertical. So that's 1, and then horizontal. So that's 2, and then you're doing the diagonals. And that's 3, okay? So, think of a star or something like that helps, okay? We're through.
Any
All right.
questions?
Oh, yeah. All right, so we're gonna do, and if she had had any drainage in her lacrimal glands, I would have noted it. I usually do. I always have gunk in my eyes because I have really bad allergies. So, you know, a lot of times it'll be crusted, or sometimes it'll be, you know, white, thick stuff.
No
So.
tenderness to palpation, moist and pink, white and moist,
Yeah.
and then the perla, and you want to put in the width of the pupils and the color of the iris. And
Okay. All right, we're moving right along to ears. So I'm going to take a look at her external ears, and they appear to be on the sides of her head. I watched an old X-Files episode that the kid did have ears on the side of his head, so there you have it. It was alien DNA.
who have been burned also
Yeah.
are missing
Mhm.
ears.
And actually that's a birth defect, that the pinna is curled up. So anyway,
Mine are floppy.
so I'm looking, she's an elf. We had one picture of you as an elf, right? So I'm looking at her ears, and at the same time, I'm feeling, and there are no lumps. Is there any tenderness when I do that? Kind of. Growing back there.
Oh, good.
Growing back there.
They're pierced.
Yeah, and they are pierced, that's right. So, the next thing I'm going to go
Bilateral.
bilateral.
Yeah, non-tender to palpation. Skin is uniform in color. Pierced. One piercing bilaterally in lobes.
So, I'm just going to sit here and have the table this way. So the first thing I'm going to do is I'm going to go up and back, because she's an adult, right? And I'm just going to start out by looking at the ear canal before I stick that in there. And her canal is clear. It's not blocked with wax or anything. So her canal is clear, and it's not red. And sometimes you'll get edema in there. It's not swollen at all. It's wide open. And I'm a lefty, so I'll just do it with my right hand.
It's the hardest part is to do it on the side that you have a hard time holding.
I'm going to go up and back, and I'm going to look, and what I see is a little bit of cerumen, but not very much at all. And on her eardrum, it's pearly white, and there's this one spot on it that just shines, and that's the light reflex. Okay, so her eardrum is intact. It's white. Some people have gray eardrums. So
White or gray or shiny, with light reflex present. Hopefully.
you may get people who you can't see their eardrum because of the cerumen, and so then you just say tympanic membrane not visualized because it's the cerumen. Okay.
Just like eschar on a pressure ulcer. Can't stage it, can't see it.
Yeah, and then I go over on the other side. Okay, like that, and then we're gonna. If I was gonna test her hearing for real, I'd have headphones and do the little tones and that kind of stuff. But we're not gonna do that. So anyway, I'm gonna say I would stand behind her action. And I would like you to put your hand over your ear, and I'm going to say 3 words. Would you repeat them back to me? Pencil. Yeah, I said pencil twice. So, because I didn't think you heard me the first time. Okay, I'll go one syllable. Okay.
No, I don't have great hearing either. So.
Okay, well anyway, so I would whisper 3 words on this side, and then I would go over here and I would whisper 3 words on this side, and then I would say she's deaf. Okay.
I actually do have noise-induced hearing loss from when I was a firefighter
Yeah.
and the chainsaws and everything. Like,
Oh, I have
just a tiny
terrible
bit.
tinnitus, so I have some hearing loss too. So, anyway, so there you go. Hearing intact, hearing diminished,
Hearing is mildly diminished.
and can hear
Bilaterally, refer
can
to
hear
doctor.
whispered voice. Normally, bilaterally is another way to say it. Robert,
Do we need to document the eardrum position?
No, just say light reflex is present.
you're not nurse practitioners yet, my dear.
Question.
Someday, someday.
It's usually supposed to like kind of point away down. That's fine, as long as you can see it and it's not all
Extra small.
weirdly, and it looks like it's in that cone shape. That's what you're looking for. Those are little guys.
Yeah.
They're not latex,
Do
right?
you want other gloves?
I ain't going there.
I think she's gonna look into my nose and mouth now. That's why she's gonna look outside.
Medium?
Actually, I'm a small, but that was not small.
As long as they're not latex, to which I am sensitive.
Nitrile exam gloves, powder 3, non-sterile, chemo tested.
Yeah, those are the good ones.
Oh, chemical.
All right, so now I'm going to look at her mouth. I'll look at the outside of her lips. They're a little bit dry, but that's really not all that abnormal for people to have dry lips. Would you open your mouth a little bit for me? Okay, so I'm going to just relax your lips, okay? I'm going to look at the inside of her lips and at her buccal mucosa. I'm going to look at her gums. Her gums are pink, and they're uptight against her teeth. Same up top. Okay. We didn't get a tongue blade.
Oh, I do. I forgot. Worms. They don't taste good.
So when we come, do we have to assemble all the equipment? So I have to come down.
Yeah, we have
Okay.
all the equipment out for you, but you should.
I need to pick
You
what
should be wearing your stethoscope and your watch.
Okay.
And your scrubs, of course. And then all of the other stuff that we wouldn't expect you to own will be on a table, and you just have to remember to get it
Okay.
and bring it over to like a bedside table.
Oh, these are, I can't use these. These are Terry's.
In there, somewhere.
Kat, is there a word to describe bottom and top, you know how to do bilaterally?
Okay, I'm not gonna make you
I
wait.
would say upper and lower.
Okay.
I'll just use my
How do
little,
you chart the lips?
little stick here. So,
Lips are dry, and in like the internal mucosa of lips is pink and moist,
Yeah.
and upper and lower lips.
so one way you can look in their mouth is to, oh, thank you, Mary. Oh.
Were you gonna stab me with that?
No, I was just gonna pretend. Okay, so
I have my glasses on, so I can't see.
one way
very
you
well.
can look is to use your fingers. Another way you can look, can you just open your mouth for me? Just keep your tongue in for a minute. Is just to use your tongue blade.
And a pen light.
Mm-hmm. Thank you. Just like that. You can't see without the light, and I would have figured that out in a minute. Okay, so we've got moist mucous membranes. Okay, you stick your tongue out for me. Okay, she's got a little bit of a white coating on her tongue. You're gonna lift your tongue up. Her frenulum, is that right? Is intact? Yeah, is intact. Okay, and again, you can put it down. Her gums are pink. They're up tight against her teeth, and so I'm just gonna hold your tongue. I know that's weird. Totally weird. Okay, and then I'm gonna just. I'm sorry, you guys. I forget what I'm supposed to do now. Okay. Yeah. Yeah. Straight. Yeah. Okay.
We're gonna
I
do
test
that.
tongue strength. I try to move my
We're gonna
tongue
do
against
that
her
to the-
hand.
I
You can
know.
also use this gauze.
Yeah. Or you
It's
could
easier
use,
to hold on to a tongue with the
yeah,
gauze.
or you could have her press against this or whatever. I put my fingers in her mouth and went, why do I have my fingers in it?
Is it like you're tasting the
If I had this in my, I would have figured it out.
Part
But
of
I
your
just,
cranial nerves is the
Yeah.
muscles that control your tongue and how strong they are on either side.
so see, I just had a total blank moment.
We all do.
All right, so then I'm going to look a little bit more in her mouth. I'm going to look at her hard palate, which has ridges and is pink. I'm going to look at her soft palate. Her soft palate's moist. It's also pink
And intact.
and intact. That's right, because sometimes they aren't. And then I'm going to have her stick her tongue out, and I'm going to put my tongue blade on her tongue. I'm going to have her say ah, and what should happen?
Got
The vibration.
Yeah, her uvula should rise in the midline. Okay, so
So she's gonna look at my tonsils too while she's at it.
so her uvula rises. She's got tonsils. They're about 2+.
Oh, for sure.
Yeah, about a 2+. So, and there's some people who have a bivid uvula. It's a
It's divided,
Two.
yeah.
yeah. So if you have somebody who has that, you can chart that. Yeah. So, and her tonsils are pink. Just she doesn't have any exudate or anything like that on them, which is a good thing.
I wasn't sure
And I think that's good.
because I think I am getting over a sinus infection.
So,
In my nose too.
So is that part of the gag reflex test? Wait,
do not test their gag reflex.
Okay.
Please don't do that. I don't want to clean up puke. So just don't go there.
We don't do that for our patients either
Yeah.
in clinical sites.
Okay.
If you see them swallowing something because they're eating, you can say they're swallow and they don't choke on it.
Yeah.
They're swallowing.
Yeah,
reflex
don't
is
do that.
constant.
Okay. So now I purposefully,
We'll leave that to the doctor.
yes, I purposefully skipped the nose. And then I'm going to say, oh, I forgot the nose. And go back. Okay? So if you skip stuff, it's fine. Go back and do it. All right?
As long as you have more time.
Yeah.
Even at the end, you could be like, okay, thank you for your, oh my gosh, I forgot your nose. I'm just going to grab my pen light real quick and take a look. Thank you so much.
Yeah, so she has the skin on her nose is consistent with the skin on the rest of her face. Does this hurt? Hurt at all? No? So I'm just palpating down the cartilage here, and I don't feel any lumps or masses or anything like that. Now, here's the thing that drives me absolutely crazy. When people check inside people's nose, they will put this against the septum, and that hurts so bad. Do not ever put anything against the septum. You can use this light, or you can use that light. Please, there.
You're going to see gross stuff in my nose.
All right.
Can you do
So
that
I'm
on
going
the
to
other
ask you to
side?
tip her head back, and I'm going to look, and what I see is pink mucosa. And if I saw discharge, I would say discharge.
You will on the other side. You're going to see blood.
Oops, I'm sorry. I do see some scabbing, so you're right, there's some blood, and it's moist. And I don't see any blockages or anything, and her septum is the midline. You're not supposed to do that till I tell you to. Bad patient. Okay. Patency of nostrils. Can you please hold your finger, or I could do this. Okay, can you breathe in and out for me? Okay, so that nostril's patent. Can you breathe in and out for me? That nostril's patent. Okay? Bad patient. All right.
Yeah, try not to cue your partner.
All right.
That's something we see a lot. If you have your nursing student partner, they'll be like, so do your best not to.
Just blows air bilaterally.
Oh, NURS
Or
patent.
patent. Yours are patent bilaterally. Mucosa are hopefully pink and moist.
Yeah.
In my
Yeah.
case, you would say that the right nair is pink and moist and the left nair is pink and moist with scabbing visible.
Dried blood. Probably a better word than scabbing. Okay, so
Still
next.
gives me trouble after my surgery.
So her neck is resting right in the middle of her shoulders, which is good. And the skin on her neck is consistent with the skin everywhere else, which is good. As I look, I don't see anything protruding at all.
I have some lymph nodes.
I don't feel any masses, bumps here, and where is anything I'm doing hurt. Okay, that's good. Now, if you are going to look for lymph nodes, you guys hopefully will have your own pattern. You don't have to use my pattern, but use your pattern, however it works for you. What works for me is, let's start back here.
You're stuck on the
And then I do segmental. And then I do one cervical chain, other cervical chain. Supraclavicular, thank you, yes. Okay, that's how I do it. Doesn't matter, I can do it again from this side if you like. So I do occipital, and then I go around to postauricular.
There's like it does feel a
Yeah.
little tender there.
Yeah. And I go segmental.
She's working her way to submental. That's how she remembers it.
And then that's just on both sides of this muscle here.
If she can have them turn and
Yeah,
you can't find
yeah.
it.
And then just go out to the supraclavicular. Okay?
And you
So
want
you-
us to name them as we're doing them? Is that what?
Ideally,
Yeah. I mean, I was just doing it to tell you what I'm doing, but it would be nice because then we know what you're looking at.
we want you to talk as you go,
Yeah.
so that we know that you know what you're doing and why you're doing it.
I would like to look at her carotids. And I don't see anything jumping out at me. I can see the pulsation, but I don't see that it's,
If you guys don't see it, come up here and look at it.
well,
especially
it's
for
actually,
these.
it's better when you're laying down a little bit, but you can see just a little fluttering right there, so I can see her carotid. Okay, just flex back, and I'm going to feel on one side, and then I'm going to feel on the other side, and they're nice and strong, and they're equal. So you could say, carotid pulse 2+ equal bilaterally. And never do them both at the same time. Right?
Thank you.
Okay. And before I put my scope in, since I'm in the vicinity, I'm going to look at her trachea. Her trachea is midline, and it's mobile. Okay. And that's really not very comfortable, so be careful.
You guys all tried it on yourself, remember?
Yeah.
It's weird.
Yeah. And so then I'm going to listen for carotid bruits, and I'm going to ask her to hold her breath, because if she doesn't hold her breath, how do I know if the swishing is air or turbulence?
What I always forget.
Yeah,
Ask them to hold it.
yeah.
Mine too,
Well,
like 7 minutes in.
This stethoscope really doesn't have a bell, it has a pediatric head, but if I were listening, I would listen with a bell. So we're just going to pretend this is a bell, because I'm not taking it apart. So I'm going to listen here. Hold your breath for me, please. Okay, let it out. And I would do it on the other side, and I don't hear anything but boom, 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 boom. So no bruise present. Okay?
How exactly would bruise sound like?
It's like a murmur. A bruit is a murmur in an artery. That's exactly what it is. I believe we've gone through another page. Questions? All right, so now we're back to our last. Yeah,
Who would do the range of motion?
that's where I'm headed. Yeah, that's where I'm headed. Good question. It's just at the top of my next page. I don't know if it's on the bottom of yours or not, but we're headed to our last cranial nerve. And so I'm going to ask you to shrug your shoulders and wrist. Okay. Then I'm going to do the range of motion of her neck, or the strength of her neck. So I'm going to, well, you know what? No, I'm not. It's better to do range of motion before you do strength testing, because then you can see if there's limitations. So I think I'd do range of motion first. So I would like you to touch your chin to your chest. Okay. Back to neutral. And I'd like you to put your head back. Good. And then I'd like for you to turn over there if you can. Good. And then I'd like for you to turn over there and look at Annie.
I can't actually see their faces, so I'm like trying to figure out.
Okay, and then your ear to your shoulder without moving your shoulder. Good. Your ear to your shoulder without moving your shoulder. So I would say she has full range of motion in her neck, but perhaps it's a little limited there, although I don't know. I don't know if people actually have great range
It's
of motion.
actually really hard to get
Yeah.
your, try it. It's like
Yeah.
almost.
So I'm going to say she's got full range of motion in her neck, and then I'm going to test her strength. So I'd like you to push against my hand, and I'd like you to push against this hand, and then I'd like you to push against this, and then push back against this. Okay? She's got good strength in all directions.
Did the shoulder.
And I already did the shoulder. Okay? So, are we good? Okay. So I'm going to look at her thoracic cage, and so what I'd like for you to do is rather than me stepping behind you, can you just flip? Watch your box.
Thank you.
Okay, so I would look at her skin. I would notice whether her skin was the same as,
Go ahead. Sorry for the fat.
I would notice that her skin tone is same as the rest of her body. She does have some freckles. She doesn't have any lesions that I can see. Maybe a couple of red spots here.
I actually did have a rash.
Yeah, like a
from my
red
bra, so
papular rash there.
I have very sensitive skin.
Yeah, so maybe a red papular rash over the left scapular area and right scapular area. So probably right where a bra strap went. Yeah.
Yep.
Okay. All right. So we have
I just found
inspected.
a bra without latex.
We've inspected, and so while she's just there, I'm noticing that her respirations are very even and unlabored. She doesn't have any, she's not doing that at all. You can hardly tell she's breathing, right? And so that's a good thing. And then you want to look at excursion. And so I don't know how to do this without my back, so I'm going to do this. Okay, I'm going to tuck it. So you put your fingers on either side of her vertebrae, and then you ask her to breathe in and breathe out and breathe in and breathe out. And can you see my hands expand when she breathes? And it's from my vision and also from what I'm feeling, it's the same on both sides. Okay. So then I'm just going to go down her spine. You feel any pain when I do this?
No.
Spine seems like it's straight. Okay. And then, sorry. I'm just going to kind of put my palms of my hands on her skin. So I don't feel any lumps, any tenderness anywhere back here. Okay.
Not at the moment.
All right. And then I'm going to listen.
Well, she's back there. Might as well auscultate.
Say what?
While you're back there, you might as well
Yeah,
auscultate.
that's right. Okay, so when I move my stethoscope, I want you to take a deep breath in through your mouth and out through your nose, okay? Or no, wait a minute. In through your nose and out through your mouth, okay? I'm going to listen to the apices. And I want you to notice that I'm going down and across, down and across. Why am I doing that? Comparing one side to the other. I also want you to notice I'm not listening over the scapula, because if I listened over the scapula, I would hear nothing, right? So I would just go all the way down and then follow around lateral on both sides, okay? And I believe we are done with that side. And so that you would move around to the front of the patient, but I'm going to ask Pat to flip again. No, you're not done yet.
Oh, dang it.
Okay. All right, so you could do the same thing with something here. And you can see my hands move, and it's moving symmetrically. I can also, just as she's sitting there, look at her respirations here. They're even and labored. I don't see any kind of work of breathing going on at all. I would look at her skin, again, same skin tone as the rest of her body, a few freckles, but that's, her whole body has freckles, so we're totally good with that. If I had not checked her supraclavicular nodes, I could do that at this time. I don't care where you feel them, totally up to you. And then you can listen for breath sounds again. And you can start up with the apices. Now this is where it gets dicey because you have breast tissue, and so you're just going to have to know what level of comfort you have with the person that you're working with, whether or not you're comfortable asking them to move the breast tissue or you to move the breast tissue. Those of you who are women and who are so inclined, if you could wear a sports bra or a bathing suit, your partner will love you forever. You know, whatever, however you're comfortable. I want you to be comfortable. Okay?
And also ask them to move their own breast.
Yeah,
Always
always.
the back of
Yeah,
their hand.
yeah. And so then here we would go around, and down, and around. So I've gotten a lateral both on the front and the back. Don't have to, but
Hopefully they're clear.
I just did, and they were clear. They absolutely were. So what I had back there was I had a straight spine, no lumps, no tenderness, symmetric expansion, and clear breath sounds bilaterally. What I have up here is pretty much the same, clear breath sounds bilaterally.
What did you charge for spinous process?
Beg pardon?
What did you charge for spinals?
Midline, no lumps, bumps,
Yeah.
or masses.
Midline, no pain, no lumps, anything like that.
No tenderness.
Midline's a good word. Like that.
Yeah, if it's not bilateral, it's midline.
Yeah. Okay, and this is a place, you don't have to do it here, but this is a place you could do the upper extremity range of motion. So you could have her do her shoulders first. You want to go shoulders first? Sure. Okay, so if you let your hands just down your side, remember this is what?
Anatomical.
And it's, is it extended or flexed? Extended, right, okay. Can you lift your arms here? Okay, and then down. She can do that. And can you lift your arms like this? She can do that. How about that? Okay, good. Down. How about back? Like that. Good. Okay. Can you do like a windmill? Good. And then on the other side. Good. Okay, so what are we going to say about
pop?
about her shoulder range of motion? Full range of motion. That's right. Okay.
Bilaterally.
Yes. So now we're going to look at her elbows. Can you do this with your elbows? Okay, and it's a hinge joint, so it only moves one way. So got full range of motion in her elbows. Let's look at your wrists. Can you circle your wrists? Good. Can you point them down? Which is what kind of flexion?
Radial.
Dorsiflex or plantar flex? Hint, this is the dorsum of your hand. So plantar flexion, dorsiflexion, okay? And this is a hard one. So can you ulnar deviate? Good, okay.
Remember, you're rad.
Yeah, so radial deviation and ulnar deviation, all right? And that's hard.
I always remember plants are on the ground. Plants come
Yeah.
up from the ground, and so
Yeah.
like that's.
And I always think of the dorsum of my hand, so
And I think about sharks because the dorsal fin's on the back of the shark.
yeah. That's true. Okay, so we have full range of motion in your wrists. How about your fingers? Move your fingers for me. Can you? Good. Okay, and spread them. All right. And now you get full range of motion in your fingers, right? So now I'm going to test strength. So I would like for you just to put your arms back out again. And can you push up against my hands? And can you push down against my hands? Good. And then can you bring your arms forward like that? And then can you push in against my hands? And you can push out. Good. Okay. And then can you put your fingers out, and can you push against me, resist me pushing them in, and resist me. Okay. And then you can do the same with the wrists. So push, push. That's harder. Push, push, and, okay. And then grip. All right.
One finger, remember?
And so her strength, from the way I felt it anyway, was equal bilateral in all of her upper extremities.
Strong and equal bilateral.
So do you say patient has full range of motion on hands, or do you have to say wrist, elbows, fingers, and everything else?
You say upper.
Upper extremities would get it.
Just
Yeah.
that.
Well, I think that would get it. Okay, so this is where she's gonna lay down.
If you're feeling thorough, you can, but you don't need to. Vinta's like, no.
Ugh. Less words, less time in the writing room, right? Okay, so now we're gonna focus on her neck again a little bit. And if you couldn't see her carotid pulse before,
This is where you guys should circle around.
you can probably see it now. So I see her carotid arteries
Wait, I was needs to
here
go.
on either side, just barely fluttering on either side.
If you don't see it, say so and make her
Okay.
show it to you.
You see it? You see it fluttering? Right there? Can you see that? See that? Okay.
Anyone who doesn't see it, just on up and
Just
look.
watch your neck and watch it move. Real deep right there? Okay. And then you've got a jugular vein right there that you can't really see too much, so she's not fluid overloaded. And then you've got another one over there. I know it's there, but I don't think you can really see it very well. And if you want her to turn her head, she can turn her head. Okay. But it'll be prominent. Yeah, you'll see it like you see that vein on the back of my hand. It'll be distended and prominent. Yeah. Okay.
Again to the emergency room.
No, you don't. You raise the head of the bed. And if you raise the head of the bed 45 degrees and they've still got
there.
prominent jugular veins, then you take it to the emergency room.
You would just
Okay.
say +2, visible +2
What do you mean?
for when you document it.
Well, I'm not feeling anything. So there's no,
just
okay.
visible.
So her carotid pulsations are visible bilaterally and her jugular veins are not distended.
So can we say it's not visible to inspection or something? Because
Not visible to inspection or
That
not
would also
distended?
be
Either way,
accurate.
either way, yeah, okay.
I saw an episode of ER where they had the patient lying flat the whole time, and they said, "Look at his JVD." And I was like, "Hey."
Put his head up, right,
They never did,
yeah.
but they said that he had it.
Well, they knew the letters, you gotta give them credit for that. Okay, so I'm gonna inspect. And if I'm inspecting, I'm looking for any precordial pulsations or anything like that. I'm also looking for the area around her heart to lift up, because if you have left ventricular hypertrophy, your heart is like this, and when it beats, it actually lifts up, and that's called a lift, okay? And then I'm feeling around. Does this hurt at all? Okay, I don't feel any lumps or tenderness. And if I put my hand here, is it okay for me to put my hand here? And I felt her chest rise with every heartbeat, that's a heave. Okay, so if it's a lift, you can see it. And if it's a heave, you can feel it. Sometimes you can feel it here, and sometimes you can feel it here, because when they have really big hearts, their heart's displaced to the left. And so, I mean, it just brings your hand right up.
It's really obvious when it's there.
Yeah, there will be no doubt in
It's
your
actually
mind.
really surprising. You're like, what the? Oh my gosh.
The other
I learned
thing,
about this in nursing school.
yeah, the other thing you can do if you put your hand there is sometimes you can feel a thrill. A thrill is a murmur you can feel. And if they've got a grade 6 murmur, quite often you can feel it. And it's just like a vibration. How many of you have ever felt a shunt for dialysis? It's that same feeling. That same feeling. Okay, all right. So that I inspected and I palpated. Another place you could palpate at this point is you could palpate for the PMI. You can't feel the PMI in everybody. You just can't. Some people you can, some people you can't. So you're looking mid-clavicular, and you're going to count down 5 and go over mid-clavicular. No, we're good. And I'm going to see if I can feel it. Which I can, actually, right there. And if
See if you can see it.
and we can, yeah. So, and if you want to see it, you get down right even with it, and sometimes you can see it. I don't see it. That doesn't mean, yeah, that doesn't mean it's not there. But anyway, that's neither here
Too
nor
much
there.
fat. You can see it on thin people really well, usually.
Neither here nor there. So I've inspected, I've palpated, now I'm going to auscultate. And so I'm going to listen in my 5 spots. So I just know from eyeballing that this is where we go. So we're going to go aortic, pulmonic, and then again, you've got the dilemma, what do you do here? Do you move the breast tissue? Do you ask them to move the breast tissue? Totally up to you, however you want to do it. So then I've lost my place, right, pulmonic. So then I would go probably herbs right there. And then I think I'm going to make posterior approach here. And then listen to the other 2 places from underneath because it's just easier. Okay, so there. And then we're back at the apex where I found the PMI and where you would see it. And then while you're there, you can take an apical pulse.
For how long?
60 minutes.
Okay.
60
Okay,
seconds. Okay.
Now, you could, as I said, the stethoscope does not have a bell, so
We will be listening with you. We will check your pulse at that point. We'll either put our stethoscope right next to yours, or we will be checking the pulse to make sure you're getting an accurate apical pulse and charting it.
But
Same
a
for
bell,
breath sounds.
yeah, a bell. What I heard was love dub. I didn't hear any other S3s or S4s, no clicks or anything. So what I would just say is S1, S2, heard clearly. And then if I wanted to check for murmurs, I would use bell in all 4 places, and then I would say no murmurs or extra heart sounds present. Okay.
So you want to see us listening twice?
Yeah. So, I'm assuming your stethoscope will have both. So.
If it's a strong enough murmur, you can hear it without the bell.
Yeah. So any questions about that? It's a pretty quick assessment there. Okay.
Regular rate and rhythm, S1, S2, present to auscultation, no murmurs or adventitious.
No
sounds,
extra.
Or extra sounds.
Adventitious as long as
They said both in the book.
Really? I never heard that. Never heard that. Yeah.
Now I'm going to listen.
So when we do the 5 places, so first we will hear it with diaphragm, and then for murmur we will do it with the bell.
Right. Okay, and so then we're going to move down to the abdomen, and I'm going to ask you what's different about the abdominal exam than anything I've done so far.
You are gonna have to auscultate before you palpate.
Right, right, and that's the big mistake everybody makes. They all want to get in there and push, okay? So this is another looking place. So you're going to look at her abdominal contour. Well, first you look at her skin, and it's the same as every other skin in her body, except there's not a lot of freckles on your tummy. It probably doesn't get sun, right? Yeah. So,
I mean, yeah. Really want to show my stomach a lot.
Yeah, so her abdomen's round, and she does have a little bit of a scar right
I had
there.
an appendectomy scars.
So she has
15.
right lower quadrant, appendectomy scar. Now, if you wanted to look for pulsations, this is the place where I actually, sometimes I can see it, and sometimes I have to get down. But if you look really closely right in the middle, you can see her aorta.
Come look.
It's just quivering just a little bit right there. And if she had a big aneurysm there, it would be going.
Like,
Yeah.
it's horrifying.
Yeah.
Looks like there's an alien trying to fight its way out
Yeah.
of your belly.
Yeah, it's just a little flutter right there you can see. Okay, so I see that. And then I'm gonna listen.
So present to inspection.
What's present to inspection?
Pulsation.
Pulsations.
The pulsation.
Okay.
Do you
And if you
care which
don't-
order they listen in?
I always start here.
Yeah.
Right, no.
Yeah, okay. So
That's the
I'm gonna
order
listen,
Pulling listen.
and I hear vowel sounds.
I bet you do.
I hear vowel sounds. Vowel sounds. So I heard vowel sounds in all 4 quadrants. Some people say normo-active. I think that's fine. If they were hyperactive, they'd be real tinkly and high-pitched. If they were hypoactive, I would have had to have stayed there for a long time.
Or
Yeah. So
So tones or sounds, which do you prefer, vowel?
audible and active in all 4 quadrants, or normal active in all 4
yeah,
quadrants.
I don't care.
Describe them if they're hyper, hypo.
Yeah.
We will be listening also to see if you're accurate.
Is it always normal to see pulsations? Will sometimes on certain bodies will you not
No,
see
yeah,
it?
sometimes you don't.
Can't
And really
tell.
skinny people, you can see it's
It's
just
super obvious.
super obvious. People who have a rounder abdomen, not always.
I was excited you could still see mine.
Okay, so at that point, then you're going to palpate, and the first thing you're going to do is let them know you're going to palpate, because it scares people half to death when you touch their stomach.
And I'm ticklish.
And the other thing you're going to do is where are your eyes when you're doing this?
Face.
Face. Not on her stomach, on her face. Because she may not say she's in pain, but you may see that she's in
And
pain.
now you get to see Kyra's palpation technique versus
Okay.
mine. With mine is like this.
Oh,
Other people's is like
no, mine's different too. so-
exactly. And
Anyway.
yours is going to be different too.
So I'm just, does this hurt anywhere when I'm doing this? So I'm just soft. I'm not gonna look for,
It's just
there's no masses, it's
This
just a
she's lucky.
soft abdomen.
She's crying.
It's just a soft abdomen.
The doctors do the digging.
Yeah.
Yeah.
Ain't digging, okay? You can go deeper if you want to and your partner will let you. You can a little deeper now, tell me if it hurts, okay? I'm watching the face. And I can go deeper all the way around. And then if I want to do rebound tenderness, I'm going to say, I'm going to push my hand into your abdomen and let me know if there's any pain.
it just tickles.
Okay, all right. And then on the other side?
You only have to do one side for that.
Yeah, well, that's true. But anyway, the pain, so no pain, no rebound tenderness.
My appendix is already gone.
Yeah.
That's what I was gonna ask.
Yeah.
Would we need to do that if we knew her appendix was gone?
Well, you can have rebound tenderness for things other than appendix.
Ovaries.
Yeah. Well, I had an ovarian cyst break one time, and boy, did I have rebound tenderness.
And for the umbilicus, you just say it's midline.
Yeah, and that was
So,
actually part of my inspection. Thank you very
invisible?
much, and I didn't say it. It's midline, and hers is inverted.
Inverted.
It's in any shape. Shape of it.
Yeah, it's round.
She said rounded. She was nice enough not to say obese, but you could. This is technically obese.
And when I'm
My
pushing,
BMI is
it's
about
soft
29.
as opposed to rigid or firm. Okay.
Yeah, so soft, non-tender palpation.
Join my club. We're all gonna share this and send it to each other.
Umbilicus midline.
That's why I'm so
Inverted.
busy.
Okay.
I've deleted that.
The scar in the
Yeah.
right lower quadrant.
So
If anyone wants to see my appendix scar, you can. It's a doozy.
if you were going
That's
to
why they did
check
laparoscopy.
for femoral pulses, you would do so here. We are not going to do that. So we're done with that part of her body. Okay, and then we're going to look at her lower
You
extremities.
see all the staples too, actually.
Your partner will appreciate you if you wear shorts or sweats or something you can pull up. So I'm going to look at her skin, and I'm going to say that her skin tone is the exact same color as the whole rest of her body. There's a few freckles, but not really very many. She's got even hair distribution on both sides of her legs. I don't see her skin dry, flaky, anything like that, as I feel temperature. Her toes are a little cool, but they're equal, and they're not cold, but they're a little cool. So I would say legs warm, bilaterally and toes cool bilaterally, okay? She's got 5 toes. Not everybody does.
Equal distribution.
Yeah, equal distribution of digits.
You remember the guy at Aldercrest who's missing one of his pinky toes, right?
Yeah. She doesn't have, as I push, she doesn't have any edema that I see anywhere on that leg or on this leg. No edema bilaterally. Remember, you can have unilateral edema, and there's a big difference between bilateral edema and unilateral edema in terms of what's causing it. Okay. I don't see any varicosities or anything like that, but that would be more present when she stands up. So we'll check that again when she stands up. Then we're going to look for pulses. So you could check her post-tibials. This one's there. And that one's there. And they're about 2+, and they're equal bilaterally. And then I could check dorsales pedis.
You can see the lump on the top of my foot that hits my shoe, and that's always my landmark to find it. Go slightly.
Would we record the most furthest one away? Like we record the dorsal, would we record all of them?
Hang on, hold that thought. Okay, I feel both of those, and they're about 2+ bilaterally. Okay, she's asking about peripheral pulses. So I did not check her radial pulses. I forgot. And so if I were to check her radial pulses, I would check them both. Remember, mine are in a weird spot. Anyway, let's just say I'm checking her radial pulses because they are really in a weird spot. There you go. Okay. And they're equal bilaterally. That's the distalmost pulse in her arms. So if she's got radial pulses, we're good. We don't have to march up. If she's got at least one of these pulses on each foot, we're good. She doesn't have to march up, okay?
So we're just finding it, right? We're not gonna.
You don't count, no, it's present, and is it equal? And you grade it, okay?
1 is diminished, 2 is normal, 3 is bounding.
So if you look at her toes, and as I mentioned, she has them all. We're gonna look and see if she's got any, because people often will have little lesions in between their toes. Well, your toes are cold. Okay, so
They're really cold.
look good. Looking at the bottoms of her feet, and she's got calluses, but you expect people to have calluses on the bottom of their feet. Okay, so now we're going to do range of motion and strength on her lower extremities that we can do. Oh, you're right. Well, can't really do it on her nails all the way, but I can do.
Oh, it's going to be slow, I bet.
Yeah, it is slow. It is slow.
But now she knows. At least I had good pulses.
Yeah.
So she's like.
And actually, come to think of it, I forgot it on your fingers too, didn't I? Yeah, those are warm. Yeah, I forgot it. So let's look on this instant. Yeah. Yeah. Okay.
And remember, you can test that anywhere. It's just, it's not always as fast as under a nail.
Yeah. And you want the distal most, right? Because if you got refill there, you got refill here, right? Okay, so you actually didn't have to sit up yet. Would you?
I wanted to.
You wanted to? Would you mind?
Nope.
Okay. So I'm going to start with your hip joints, and we know she can extend. She's in an anatomic position. So can you just lift this leg up towards the ceiling and down for me? Lift this leg up toward the ceiling and down. Good. This leg out to the side. Good. This leg out to the side. Good. And then I can't go back when she's laying down, but I could make her do that when she's standing up. Which makes me walk. Okay. All right. So can you lift this leg for me and bend your knee? Okay, and put it down. And the same with this leg, and bend your knee, put it down. Okay. Can you point your toes down that way? Can you point your toes up toward your nose? Can you make your ankles rotate like that?
It's kind of hard with
And then the other way? There you go. Good. Can you wiggle your toes? Good. Okay. Now, I want you to push against my hands. Push against my hands. Good. She's sitting up.
It's because I have no core strength.
Push against my hands. Good. Push against up. Right. And then I do that side, okay? And then you could do the same with the hip.
Pushing.
Push, 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 push. Okay. So her range of motion was full. I didn't see any limitations, more or less. And her strength was equal and strong bilaterally in her lower extremities. Unless you want to say hips, knees.
So we can say that in all lower extremities bilaterally,
Sure.
full range of motion.
Sure.
Yes.
Yeah. Yeah. And so the very last thing that you want to do when they're laying down is you want to watch them get up. Because when you watch them get up, that'll tell you about their balance, it'll tell you about their core strength, it'll tell you a lot of things about them. So could you please sit up?
I'm gonna tie this first.
I want you to notice we're on the last page. Okay, so I would say, other than knocking the table over, she had very good balance while she was standing up. Okay, so
Good
just have a seat.
responses.
Okay,
Have a
we
seat.
can sit down now, I think.
Okay, so neuro, now we're going to look at, would you mind taking your glasses off? We're going to look at another cranial nerve, which has 3 branches, and all 3 are sensory. Anybody know which one that is? Starts with T. And I think I said Gemini. Okay, so I'm going to have you close your eyes, and I want you to feel this for me. It's light touch, okay? And I want you to tell me when you can feel this, all right? Now, 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 now. Okay, why didn't I do that or that? That doesn't tell me anything. You got it either side of the face. If I do that, how do I know which nerve's innervating your nose? So you got to do it on the sides of her face so that you know, okay? All right, so I will say that she has, what am I going to say? She responds to light touch bilaterally.
Touch sensation is
Yeah.
present bilaterally.
Yeah, there you go. That's good. Okay, so then you can do the same thing in her arms and her feet and her legs. Okay, so it's the same light touch thing, only arms and legs and feet. Okay, so here, now, 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 now. Okay, so light touch sense intact. Bilaterally. Now, I'm going to poke her. Not hard though. Okay, so I want you to put your arm out for me like that. And this is sharp. Wait a minute. That won't work. There's no dull. Break it. But that'll be sharp. Okay.
Use the.
Okay.
So we used to sometimes we break those and make a sharp end and a dull end.
Okay. So this is sharp.
Yep, it
And this
is.
is dull. Okay. And I want you to close your eyes, and I want you to notice I'm going nowhere near her face with this. And I want you to tell me if what you're feeling is sharp or dull. Okay?
Sharp. Dull. Dull. Sharp.
And then go the other side, and then go both legs. Okay?
So where do we document that? Is that on for? So there is sensation for face, arms, and hands.
Position sense.
Where?
No, we're not position yet.
Still under sensation, I think.
So we do. So when we do
Sensation
sensation.
to sharpen, dull, present,
Okay.
bilaterally.
Okay.
Can we put it into one, like?
Actually, what I usually, what I would say, that's not what I would say. I would say sensation to light touch and pain is what I would say, because that's pain. Intact bilateral. That's what I'd
I've
say.
seen people say
Intact and equal.
Jessica,
like
do
sensation
a
to soft,
consulting,
sharp, and
please?
dull.
Yeah,
is
that's one way to
present
say it.
and equal bilaterally
I'd say pain and light touch, but either way.
on face, upper and lower extremities.
Okay, so position sense, as Annie observed, is coming next. So I'm going to take your hand and hold it out here, and I'm going to close your eyes, and I want you to tell me which way I'm moving your fingers. So then I put my hands on either side of the finger, down, down, up, okay, and then the other hand, and then her feet. So you're looking for down and up. And you're not doing this, right? Because that's pretty obvious. But small gradations. And have them close
And do
their
it on a
eyes.
few fingers
Yeah.
on each side.
Yeah.
Like, don't just do one.
Yeah. And have them close their eyes.
So what would be the documentation?
Position sense intact bilaterally in hands and feet. All right. So we're on the home stretch here. So can you touch your finger to your nose? Good. And then another thing you can do, although you don't necessarily have to, is this: touch my finger, touch your nose. My finger, your nose. My finger. Yeah. Okay. Yeah.
I'm not drunk.
Yeah. You don't have to do that. And
Let me try again.
yeah. Oh, that's right. And then the last thing I would have her do is run her heel down her shin. So can you take your heel, put it up your knee, and run it down your shin? Good. And then the other side, heel down shin. Okay. So heel down shin.
So we can say heel down shin intact, bilateral.
Or patient able to.
Mm-hmm.
Would you want to chart if it's smooth or not?
Yeah.
Patient movement to feel down shin. Like smooth. Yeah, bilaterally.
That's good. Yeah. Okay, so you have her stand up. This is another time where you're going to watch what she's doing, because you're going to see, is she doing this or is she getting up with a fluid motion? Okay.
I took my leave this morning.
Okay. So yeah.
Also, I know the table's going to buck on me.
Chart the finger to toes assessment. What do you want?
Fingers to toes.
I mean,
How do you chart it?
what are you saying?
We used to say cadence, I think we looked it up.
Yeah.
This is, if you do this, you're doing it with equal cadence. You're not going.
I don't like that one.
Yeah,
Yeah,
that
so-
was hard.
So that's
I wouldn't.
that.
I don't make them do that. That's hard. They're having a hard
How
time.
would you chart it again? Just nose to finger front.
Accuracy?
Patient able to complete finger to nose touch
Accurately.
accurately, bilaterally.
Yeah.
Something like that.
Actually, honestly, I'd say cerebellar function intact, but I wouldn't get good grades if I said that. I'm honest. Okay, so I watched when she stood up, and her standing up motion was smooth. So that tells me that she's got some core strength, right? If you wanted to continue your range of motion on her hips, you could have her turn around and hold on. And can you move one leg back so she can hyperextend, and then the other leg back so she can hyperextend that one, okay? So, and I'm not going to make you circumduct your hip.
Thank you.
So I'd like for you to walk over to Annie and back, just with a normal gait. And back. And then this time I want you to walk over to Annie, and I want you to put your heels next to your toes as you go.
I find this is hard the more out of shape I get.
All right, and then can you walk back on your toes? Tippy toes? All right, and then can you come over by me on your heels? Good. All right, so her gait is fluid. I don't know another word for gait.
Gait is one I would use.
Yeah.
Yeah, gait is fluid.
Okay, you like that sitting, yeah.
Oh, and I stand up. You told me to sit down.
Okay, so you're going to do a Romberg, and this is one where you're going to have them close their eyes, and some people sway and they don't know they're going to sway, and there's no way you can know if they're going to sway. So be next to them, please, and catch them if you need to. So can you just put your hands out for me, please?
Stand by assist.
And can you close your eyes for me? And then just have them stand there. Okay, good. So that's a negative Romberg. If it was positive, she'd be swaying all over.
I'd be like, and my arm might droop.
Yeah, her arm would drift, yeah. Okay, and then while you're back there, I moved. While you're back there, you would have her bend over. Can you bend over and touch your toes? No. For me? And I would run my fingers down her spine. Does that hurt at all? No. Check for scoliosis. Good.
I don't think I have any.
No, your spine's straight. Okay, and then can you bend back? Good. And can you twist your spine this way? Good. And twist your spine that way? Good. And then can you bend like that? Good. And then on the other side? Good. Excellent. Okay, what did I forget? Anything?
Stabilizing, probably, that's it.
Yeah.
Or did she do lean back?
She didn't need it.
So full range of motion.
What would be
and
the spinal
spine.
range of motion?
Spine, would you
You
measure
just
it?
don't do that. I mean, the strength of
That was
spine
a
was
mistake.
she was able to get up from a
Oh.
seated position, and she was able to stand up from a seated position. So you know she's
Okay.
got core strength.
Perfect
She
timing.
can't if she can
Can
get
you
up on
stop?
her own.
Sits
You wanna-
and stands
we're done.
with fluid motion